So we talked a little bit about crease height in our first consultation, and you have an intermittent crease on your left side, and we've determined that it sits at 7 millimeters. So we just measured that crease at 7 millimeters. That's perfect. So the plan is to give you a crease on the opposite side at 7 millimeters as well, and to make the crease that you have now deeper and travel all the way across your eyelid. We're also going to flare it a little bit so it's slightly higher at the outside, and we're going to make that 1 millimeter higher on the outside. So what we want to look for at this point is just to make sure we've got symmetry, so they're flaring a little bit towards the outside on both sides. So the first step is just to make the incision very precisely along the pre-marked crease. So once that's done, then we do the upper incision that's pre-marked. Okay, so there's skin muscle that we cut through on either end, and now we're seeing that orbital fat. So we're sort of through the orbital septum. You can see how that fat's starting to really come out. So we'll take a little bite of the skin here, and then we'll grab some of the levator down here, and then we'll grab the skin on top. So that's invaginating the skin down onto the levator, and it'll scar in place there with the stitches. It'll just stay in there for a week. Tiffany, you can open your eyes, look way up. Okay, so you've got very well formed creases at this point. What you'll see when you go home is that the lid on your left is more swollen. We got a little bit of bleeding in there as we put some of the last stitches in. That's quite common. It won't cause any problems other than bruising. And we've closed the incision other than the fixation stitches with these little blue stitches, so keep those taped out of the way so they don't poke in the eye.